Hello and welcome to my weekly video blog, and today on A Vogel Talks Menopause I'm going to be talking about, can shortness of breath be a perimenopause and menopause symptom? If you like my tips and advice, then please subscribe and remember to hit the bell icon so you can be notified of all my new videos. So are you finding it difficult to catch your breath when you're doing nothing? Do you find that you're wheezing a bit, that maybe you're getting a little bit breathless just walking around the house or doing very little? So this is one of these strange symptoms of the perimenopause and menopause, but one that seems to be becoming more and more common over time. So today I'm going to look at what causes it, what you can do to help yourself. But just be aware, when we're talking here, the really important thing to bear in mind is that if we are doing strenuous exercise or we're, a lot of action is going on, then shortness of breath and wheeziness is actually quite common. It's something that happens after doing these activities. So what I'm talking about today is not in that particular situation, but it's just when you're doing things in your day-to-day life. So what we're looking at here is symptoms can include just shortness of breath. It's called air hunger. So you just find that you can't seem to catch your breath. You may find that you're having to make more of an effort, because if you think about it, we don't think about breathing when we're doing things. So if you're actually having to focus on breathing, you're taking deeper breaths because you feel out of breath when you're not actually doing anything, then that would be one of the symptoms. It can be where you're experiencing this where you didn't beforehand. So again, if you're maybe just walking around the supermarket and you suddenly find that you're having to take a few deep breaths or even stop to catch your breath, then that certainly would be one of the issues here as well. So what they found too is that there was a study done looking at menopausal women, and they found that over time lung function did decrease just slightly, and also if you smoke as well, that can be a particular issue as well. But again, in this situation, it would be maybe where you're a non-smoker and you're suddenly getting that cough and that wheeziness as well. So what can happen is that falling estrogen affects the mucous membranes, and we know that vaginal dryness is a really common symptom, but falling estrogen can also affect the mucous membranes in the lungs, so they dry out a little bit, and that's where you would end up getting the kind of wheeziness. And also, if your lungs are not kind of lubricated enough, then it's going to be more difficult to expand them as you take air in. It could be stress that's doing it, and we know that if you're really stressed, you tend to shallow breathe, so you're only using the very top part of your lungs, so you tend to have very sort of shallow, quick breaths if you're suffering from stress and anxiety. It could be excessive weight, and we know in the menopause and the perimenopause that weight gain is a problem. So if you put on quite a lot of weight, then that's going to affect your lung function too. It could be a pre-existing symptom. So if you already have asthma, if you already tend to get quite severe hay fever, which is causing you to get that wheeziness and the coughing and having to take really deep breaths, then all the hormonal changes in the menopause could actually make that condition worse. So this is one to be aware of. Asthma can be really serious. So if you find in the perimenopause and menopause that your asthma is getting worse, then this is something you really need to speak to your doctor about, just to make sure that you're getting the correct treatment for this particular type of situation. So again, and it can be allergies, not just hay fever, but if you live in a very busy city, if there's a lot of air pollution, you may find that your lungs are far more affected, or you know, you can have things like pet hair and fur allergies, paint and perfume allergies. So again, these can suddenly appear in the perimenopause and menopause, but if you're already susceptible, then these can get worse as well. So you can also look, and one other issue that's quite interesting that can be a factor is low blood pressure. Now, in the menopause and perimenopause, high blood pressure, getting high blood pressure is more the norm for the majority of women. And this is one of these conditions that tends to have no symptoms at all. But for the few women, it can be low blood pressure. So if you're getting the wheeziness, the breathlessness, and also that may be accompanied by dizziness, then it might be a good idea just to get your blood pressure checked out, either by your doctor or in the UK, you can actually ask your pharmacist to do it for you. And the other one, of course, is dehydration. The lungs are mucous membranes. They need lots of water in order to keep them really well hydrated. So what can you do here to help yourself? So remember the water. Plenty of water, really, really important as always. Do regular breathing exercises. And again, you can get super breathing exercises on YouTube. You only need to practice for a couple of minutes, 2 or 3 times a day. That can be really, really helpful. And that's just to help to increase and strengthen your lungs generally, which is no bad things. Manage your stress. If you find you're doing the really shallow, quick breathing, then anything you can do to reduce stress and anxiety is going to be helpful here as well. For those of you that smoke, the problem with this on many levels is obviously it's going to affect your lung function. But if you've been smoking for a long time, that can actually bring your menopause on a few years earlier than it would normally. So this is a really good reason to try and give up smoking. As far as I'm aware now, there's a lot of research also coming out about vaping being bad for the lungs. So just be aware of that for those of you who've maybe stop smoking and have gone on to vapes, because that could be a problem as well. And remember, as I mentioned before, if you already have existing lung conditions that have started to get worse with all the hormonal changes, please do speak to your doctor about this. So I hope you found this one helpful. Oh, one last thing I forgot is for dry lungs, if your lungs are getting a bit dry, sea buckthorn oil supplement can be really, really effective. So it's a good one to add in. And also remember, sea buckthorn is good for vaginal dryness, dry skin, dry mouth, and dry eyes as well. So it's a really good menopausal remedy. So as I said before, I hope you found this one helpful. If any of you have any other really good tips for this, or you found a particular breathing exercise really helpful, then please do share them with us. I love to read everything. And until then, I will see you next week for another edition of A Vogel Talks Menopause.